I'm here today to share with you some pretty revolutionary research. Research that we believe has the ability to improve the lives of millions of shift workers around the world, so it's pretty exciting stuff. I'd like to start by having you imagine something for me. You're in your early 20s, you've just finished uni, and you've gotten your first full-time job. Now, this job happens to be full-time shift work, and you don't know any shift workers personally, but I mean, how hard can it really be? You're young and invincible, so you'll just figure it out as you go. Let's fast forward. Now you've been in the job for a couple of years and the fatiguing effects of full-time shift work are really catching up with you. You're not sure how to sleep during the day before night shift, and do you change your sleep schedule on your days off? It's all a bit confusing, so you ask some of your colleagues what they do. How do they cope with shift work? But the problem is the advice they give you is wildly varying. Let's fast forward again. Now you've been in the job for 10 years and you never figured those things out. You never figured out how to sleep during the day or if you're supposed to be changing your schedule around, and it shows. You've gained 25 kilos, you're tired all the time, you don't feel good about yourself or your job. What do you do? Well, that was me, and I started Googling how to improve my health as a shift worker. And I kept coming across sleep as this common theme, but specifically this thing called sleep hygiene. Now, despite having a health degree, I wasn't familiar with sleep hygiene as a concept, but it's essentially those daily lifestyle and environmental factors that, depending on how we engage with them, can either benefit or harm our sleep. So things like how much caffeine you consume or the regularity of your sleep schedule. Now, this sounds like the exact information I was looking for, right? Well, sleep hygiene is based on a diurnal sleep pattern. So it assumes you're up and active during the day and then sleeping at night. So how could I apply this sort of advice to myself as a shift worker if I couldn't maintain that kind of sleep pattern? In fact, a lot of the advice I was coming across was completely impractical and in some cases contrary to fatigue management advice, like avoid caffeine in the afternoon, but what if I'm about to start a night shift? We have more than 2 million shift workers in Australia alone, and our recent research has shown that up to 85% of them feel this way about sleep hygiene. They just don't get it. So this project set out to address that. We went around the world and we brought together sleep, shift work and occupational health experts, and we asked them, do you think shift workers need tailored sleep hygiene advice? And they overwhelmingly agreed that they did. So we asked them to help us create it. We used something called a Delphi methodology, where we had these experts provide us with consecutive rounds of feedback so that we could slowly construct a set of tailored sleep hygiene guidelines just for shift workers. And we knew we were getting the information right because by the end of this process, we had overwhelming consensus amongst the experts that the advice was just right. But there was one more step, and we needed to name this advice. You see, we felt that sleep hygiene was a bit of a misnomer because it doesn't really have anything to do with how clean you are when you go to bed. So these experts agreed that we would call this advice healthy sleep practices for shift workers. That made way more sense. Now, for the first time ever, we have expert-developed information just for shift workers in the form of 18 easy-to-understand guidelines that help them figure out what they need to do to really optimize their sleep. I'll give you an example of how this differs from existing sleep hygiene advice. If you were to go and look that up now, you might read about avoiding or limiting daytime napping, and that's really good advice for the general population. Shift workers actually rely on daytime sleep, particularly when they're working night shift. So our advice helps shift workers figure out how they can use naps and daytime sleeps to their advantage. Short, sharp naps, 15 to 20 minutes for a great energy boost, and then longer naps when they need to chip away at their sleep debt. So what are the next steps? Well, we need to get these guidelines into the hands of shift workers. I mean, if I could wind the clock back and give a copy of these guidelines to a younger version of myself, I would have been so much better equipped to manage the fatiguing effects of shift work. And the possibility that we could make that kind of difference in the lives of millions of shift workers around the world is truly exciting. So if you're a shift worker or you know a shift worker, 1 in 5 of us are shift workers, you can now head to the Sleep Health Foundation website and you can grab a copy of the guidelines for yourself, because a healthier, more well-rested workforce really benefits us all.